So you're doing aligners and you're trying to figure out, how can I get more case acceptances? In this video, I'm going to walk you through exactly how you can double your case acceptance rate with Invisalign. I know you can double it because right now you're not even talking about it. So the first thing that you have to make sure that you do is you have to make sure that you are implementing wellness scans in your practice. What is a wellness scan? Well, a wellness scan is when your team scans a patient with a digital scanner. An example of this is the iTero, a Trios, Dandy, and many other brands out there. But what the scan does is it doesn't just replace an impression. A scan is an educational tool that literally supercharges your practice. What I mean by that is when you are spending time talking to your patients and educating them and telling them things, traditionally, you're just pointing to a black and gray x-ray and you're asking the patient to decipher between 50 shades of gray and what's a cavity and what's not a cavity. So what a scanner does is it takes a model of the mouth and it projects it in color on an LED screen that's either on the scanner or it's on your monitor in the room. And what this does now is it lets the patient for the first time in their life see their mouth up close and in person. You can zoom in on things and actually have a conversation about what's going on in the patient's mouth, as opposed to asking them to use their imagination to imagine this cracked tooth or this cavity. And so this interactive experience gets the patient to start feeling more emotions about their mouth. This is the number one way to get your patient to actually buy into their oral health even more than they already do. Because when somebody can see something, they don't have to imagine it because they see it. So once you have that wellness scan and once you've had the patient look at it, actually sit down with them and show them what's going on. Walk them through their mouth the same way that you do when you look at it with your eyes and then you think about what's going on. Literally, sit there, point at stuff, ask the patient, what do you think about this? What do you see? What jumps out at you? Do you have any questions about anything that you see? Do you see the inflammation here? Do you see the chipped tooth here? Do you see how your teeth aren't in alignment here and that's why you have all this plaque? Do you see the recession? Do you see the broken teeth? All these things are stuff that you can tell and show your patient. And I guarantee you, you are going to have such an amazing conversation with them because you are going to literally transform the way that they view their mouth. And it's all meant for a greater benefit. Now, once you've shown your patient, I want you to do something that you're very comfortable doing, and that's educate them. All dentists love educating their patients. So once you show them and you educate them, this is how you're going to get the patient to understand what's going on with their mouth. They're going to understand why there's problems, right? So you've identified issues and now you're explaining them. So now the patient is very much engaged with what's going on. This is the point where you start to ask the patient how they feel about what's going on. Now you're tapping into the emotional side of the patient. So think about this. If you're a patient and you go to the office and all of a sudden they roll out this scanner and they start taking pictures of your mouth and then now it's on a screen and then you're looking at that and you're automatically judging that mouth. And it's funny because that's their own mouth. So now all of a sudden they're seeing all the things that you have always seen for months or years, but they're seeing it full blown in their face. Now they're going to have questions. So when they have questions, you have to be ready to answer them. I'm telling you, this happens every time. You start showing them issues, they will literally ask you, Doc, what can we do to fix it? What are my options? When you reach that moment in the exam, that is the best moment because now you have a patient that is educated and they are determined to find a solution. And guess who has the solutions to their problems? You do. This is where your confidence is going to be key. You have to be able to take their problem and explain to them the consequences on what happens if they don't do anything, and then walk them through their options that are going to be the solutions to that problem. People like to call this problem, consequence, solution. And it's the perfect recipe to get a patient that is completely aware of what's going on. They understand the risks, they understand the rewards, and more likely than not, they're going to accept treatment with you. You cannot point to a broken tooth and just say, you need a crown, and expect for the patient to actually want to commit to treatment. Sure, if you've been practicing for 15 years and you have a relationship with this patient, they'll accept treatment and you can get away with doing that. But if you're a newer dentist or this is the first or second time you're meeting the patient, they have no reason to trust you, right? So going through this whole process of taking the scan, walking them through everything, you are building trust in that entire experience. So let's take for an example, patient comes in, they have crowded teeth, right? And you walk them through everything. You took a scan, you showed them what's going on, and then now you've told them, hey, your teeth are crowded. This is causing a lot of plaque buildup. A result of the plaque buildup is that your gums are inflamed. And now when your gums are inflamed, this is now contributing also to the bone loss that's happening. And a solution that can correct all these issues is straightening your teeth out. Because when you straighten straighten your teeth out, you have less buildup and you can actually floss between your teeth. Isn't this what everybody wants? They want to floss their teeth. Okay, they may not want to floss their teeth, but they want to floss their teeth more efficiently. And that's what you're able to do. You straighten the teeth out. Now all of a sudden you are improving their oral health. And then to really take it to the next level, on most scanners, they have a simulator where they can actually simulate where the teeth are positioned and what they will look like if they align their teeth with aligners. You show your patient that, magical. Because now the patient can see where they're at, they can see where they can go, and they're looking to you to know when they can start. And that's how you double your case acceptance with aligners. Doc, if you're still interested and you want to learn more about aligners, be sure to check out the next video in this clear aligner series. You can also follow me on Instagram at dr.avi. I share clear aligner tips and daily motivational videos for dentists. Also, if you're interested in getting started with aligners, I have created a free masterclass just for you. In that masterclass, I walk you through exactly how to get 3 more case starts tomorrow with aligners. And if you enjoyed this video, don't forget to please drill that like and subscribe button, but more importantly, share this video with your dental colleagues. My goal is to provide as much valuable information for you and fellow dentists because I believe that with more information, we can be better together. Thanks again for watching. I'll see you in the next video.